For demography.
For demography, okay, myself, I did my first degree dekat International Islamic University, majoring in psychology lah, bachelor in human sciences and Islamic living knowledge, majoring in psychology, and I did my training in a hospital setting for 1 year under UKM, and I have master in counselling at Open University. And what else? I'm member of Malaysian Psychological Association and also member of American Psychological Association, and I'm also part of Malaysian Relief Agency untuk mental health professional psychosocial mental health psychosocial support, MPHSS. So been in this profession since my first degree itself until sekarang, and along the way I further up my study, and also I did part-time teaching for psychology subject for about 10 years to keep me abreast with the theory lah, so that I can can help me in my practical setting. Kadang-kadang kita practice saja kita terlupa teori dah kan. So I teach part-timely for psychology subjects lah, so that relevant to keep myself relevant.
So our topic for today is about faking mental illness. This condition usually occurs among people who tend to self-diagnose themselves. So the first question is, so about it, do you have any acquaintance who you think are faking mental illnesses, or how did you notice it?
Okay, mental illness ni dia come with the spectrum, from mild to profound, mild, moderate, severe and profound, right? Okay, but for us in this helping profession, in this area of helping profession, we cannot do any diagnosis, even though kita belajar, we have the manual for the mental illness and we learn using this manual, but we cannot diagnose because the diagnosis only the authority of the psychiatrist, and the psychiatrist will tell whether this is the real mental health issues, or the faking mental health issues, or the only the stress, wear and tear of our day-to-day issues only, not up to the level of mental health, right? So for me, if we have SOP in our dealing with our client, so if within the SOP requires us to do the further referral, then we refer, and the doctor will determine whether it is a fake illness or it is an authentic illness.
In your opinion, why do some people fake mental illnesses?
Why do some people fake mental illnesses? I mean, first and foremost, it's not our job to judge they are faking or not. For us here, when people come, it's a crying for help. Kalau lah kata dia fake their illnesses pun, there are some issues that need to be dealt with that. Dia is crying for help. Kita kena tengok apakah isu dia sebenarnya, kan? Mungkin dia tak boleh bergaul dengan kawan, kan? That's why they refuse to go anywhere, just nak be on their own, kan? Mungkin dia ada family issues, dia malu untuk menyuarakan, kan? Mungkin dia orang coming from poverty, kan? So tak ada duit, kan? So that's why macam limits of going to the classes, or tak boleh nak buat certain assignments sebab laptop rosak and then tak boleh nak baiki, something like that. So even the true cases or the fake case coming over here is always a cry for help, and then kita kena tolong. And then as I mentioned earlier, whatever yang datang dekat sini, kita kena kami tak boleh judge, we cannot judge. We have to send to the doctor. When the doctor say this is some illness lah ada dalam diagnostic manual, that the fake kind of illness. Doctor say this is only this, or doctor will say that, oh, this is not a mental health issue, this is just a stress. You need to go back to your counselor or your psychologist at university to do some counseling or psychotherapy sessions, something like that.
So based on it, what is the impact of faking mental illnesses on society?
Faking mental illness society, if these people who really fake but didn't come for help, they keep on having the attitude of cheating lah, menipu. So menipu ni not only faking in mental health, menipu in any other sense also is not very good, because it's about integrity, right? So when the integrity is being tarnished, there will be an impact to the society lah, either directly or indirectly, right? So it's about integrity. Jadi itulah. But as I mentioned earlier, everybody yang datang kat sini kita terima, dan kita tidak simply accept yang dia want to sakit simply like that. Kita identify, kita dengar, and then kalau kita rasa is about motivate them, polishing their resilience, to help them enhance their resilience, we are there to enhance their resilience. If we think that they are really in the position that requires help, we will help them. We will send to further referral, further expertise, and then we do the combination of the treatment lah, pharmacotherapy by the doctor and psychotherapy by us here at PCS level.
I think that the way to prevent, yeah, and to help them.
The way to help them.
Yeah.
For the prevention, yes, we go to the classes sometimes. There are 2 programs now for prevention. We have towards community wellness. Normally we go to the classes before the exam, and then start right and bright, beginning of the semester. We go to the classes, so we tell them what to anticipate, how to prepare, how to ignite their internal motivation, intrinsic motivation, so that dia orang pergi. But of course lah, kalau kita open macam tu, berapa orang je yang datang kan? So kalau kita buat open macam tu, tak ramai yang datang. Sekarang kita buat collaborate with the department, so adalah juga kan yang datang, yang hadir.
Alright, I think that's all. Thank you for spending your time.
Alright.
Yeah.
Yes.